Case.
Chair, Ranking Member, and members of the subcommittee, aloha and mahalo for the opportunity to seek the subcommittee's continued support of critical health and education programs assisting the unique needs of Native Hawaiians in my home state of Hawaii and throughout the United States. Native Hawaiians are the indigenous peoples of our country whose homeland is Hawaii. Our nation's historical and unique legal relationship with the Native Hawaiian community has been consistently recognized and affirmed through laws that extend to Native Hawaiians many of the rights, privileges, and programs afforded to American Indians and Alaska Natives. Just as Native Hawaiians are a unique community within our national fabric, so are many of their challenges and needs, especially in health and education. Specifically, Congress passed the Native Hawaiian Health Care Act to address the severe health needs of the Native Hawaiian population. For example, Native Hawaiians have experienced disproportionately high rates of obesity, hypertension, asthma, diabetes, and other chronic diseases. These disparities are in large part perpetuated because of systemic barriers to healthcare and social determinants of health. Under that act, Congress has consistently supported strong funding for the Native Hawaiian healthcare systems to address these disparities. Specifically, the Native Hawaiian healthcare systems provide primary, dental, and behavioral care, as well as make available health education, health promotion, disease prevention, and Native Hawaiian traditional healing services to fit the needs of their respective communities. Your continued support for the Native Hawaiian healthcare systems is especially needed now as we work to get through the pandemic. I also asked for the subcommittee's supportive report language directing the National Health Services Corps' loan repayment program to recruit and retain providers to work in areas that serve Native Hawaiians and Pacific Islanders. This more carefully tailored funding would help address health workforce shortages and strengthen the health career pipeline while also providing better care and outcome for these traditionally underserved populations. Primarily through the Native Hawaiian Education Act, Congress has also consistently provided federal funding to address the educational attainment gap between Native Hawaiian students and their peers. Native Hawaiians have historically performed below national norms in reading, science, math, and social science, and are underrepresented in higher education. All of these trends have been amplified by the COVID-19 pandemic. That Act's supplemental education services provide for the unique educational needs of Native Hawaiian students and recognize the role of languages and cultures in their educational success and long-term well-being. Native Hawaiian education grants support innovative and effective programs such as the Partners in Development Foundation's Tutu and Me Traveling Preschool and Aha Puanaleo's Hawaiian language revitalization activities and immersion schools. Native Hawaiian education grants also help finance scholarships and college transition opportunities, including career and technical education and science, technology, engineering, and math outreach targeted towards Native Hawaiian students in high poverty areas across Hawaii. Your continued support for the Native Hawaiian education program is requested to increase college readiness, access, and success for Native Hawaiian students, especially for those who are most at risk of not attending college. Additionally, the Strengthening Alaska Native and Native Hawaiian Serving Institutions program provides funding for tutoring, mentorships, internships, faculty development, and other initiatives to better meet the needs of Alaska Native and Native Hawaiian students at the collegiate level. In closing, I want to extend my warmest mahalo to this subcommittee for your consideration of these requests in this upcoming fiscal year, and for your continued partnership in our efforts to improve and promote resilience and advancement in our Native Hawaiian community. Aloha, and I yield back.
Aloha, and thank you. Thank you so much for your testimony. And more than just the testimony, your which comes through your deep commitment to making sure that the Native Hawaiian population and others have the health assistance that they need and the educational opportunities they need. And you wanted just a strong advocate you are, Congressman Case, for those issues. And these issues come up every year, and we will look hard at those requests, because I think, once again, this is a moment when, again, the virus has exposed the real disparities and to underserved communities, and what we need to be doing, and whether that is in education or in health or in the economy. So if we can look at how we can begin to build that architecture for the future that puts it's not programs that assists people. We need to be talking in terms of people and not programs, of what this does in terms of turning around the lives of folks in your communities. And so I look forward to working with you as we look to expanding Native Hawaiian healthcare, as we look into the set-asides for Pacific Islanders and Native Hawaiians, and how we move in terms of the education space as well to give people that opportunity for success. So thanks so much for being with us today. I appreciate it. Thank you.